I quit nursing. Let's talk about it. Let's freaking talk about it.
13-year nurse chiming in, and Anna, good for you. So I can't lie, I hadn't heard about Anna Heid until today. I came across another video talking about her leaving nursing, and it was a little bit judgy, but there's a lot of hurt. There's a lot of hurt here. We're losing somebody that was valuable to the nursing workforce. We're already losing bedside nurses at such alarming rates. So I understand, where that person was coming from, but I also understand where Anna's coming from. And it's not because I want to leave nursing. I definitely thought of it, but it's because of the untenable workforce conditions that we face now. And I really am kind of shocked to hear that the general public doesn't understand what we're dealing with, and there's just so much judgment on us. So let's talk about it. So having been a nurse for over a decade now, I've seen how nursing has changed over the years, and honestly, it's just gotten worse year over year over year. And especially during and after the pandemic, things have just kind of reached a fever pitch. So let's talk about how the general public views us and how they've responded to us, and where I don't understand we lost a whole lot of respect. So during the pandemic, we really saw a shift from the public from one of relative respect and, reverence for the nursing profession to one of judgment and hatred. And, when nurses were speaking out on social media about the horrible conditions that we were all working under, having to reuse N95s when we knew that those were kind of our lifeline. We were walking into situations where we were being asked to put our lives on the line, and for any amount of money, we shouldn't be judged for that because we're human. And I think a lot of the public forgot that we are human. And in the nursing profession, just in general, we're kind of expected to be superhuman, put our emotions aside, leave our lives at the door, and then just focus on the task at hand. And in many ways, yeah, I get that. And I am very good at compartmentalizing in many ways, but we're not acknowledging that as human beings, a lot of us were traumatized. We're already traumatized by the work that we do because it's very hard work. We see people die. We see horrible injuries. We are with people in their grief as they're losing their loved ones, or, they're at end of life when, people may not have loved ones around them, and we're holding their hands, Not to talk too much about my experience, but I was literally holding someone's hand while they were dying of COVID while their family watched from outside the building, just to kind of put it into perspective. These are things that affect us emotionally. There's been a lot of talk about trauma and healing over the years, and I think that by leaving the entire nursing profession out of that discussion, we're doing a disservice to an entire workforce. So there's a little bit of context there. And then Anna talks about how she makes like 5 times as much as a nurse, as she does as a nurse, through influencing. And girl, get your money. Nurses in the United States make criminally low pay. None of us make enough for the work that we do. And I don't think a lot of people realize that what we're paid for permanent positions is keeping our heads barely above water, and for literally saving lives. So the average annual salary or an annual pay for an LVN LPN in the United States is $59,000, while the average pay for an RN in the United States is $80,000. And then we hear about influencers that are making 5 times as much for not doing the work that we do. Who wouldn't see that the grass may be greener over there? You don't have to deal with death and dying and being disrespected by patients and fellow nurses and management and the capitalist healthcare model just in general. So I don't fault her for that at all, and I don't see why anybody else would. Now, let me gather myself. Let's couple this information with the fact that The corporate or capitalist healthcare model has continually tasked us with doing more with less. We are constantly short-staffed. There are so many nurses that, because they're barely keeping their heads above water, work ridiculous amounts of overtime. And honestly, there needs to be a national cap on that, and kind of a universal pay increase to combat the additional stress that we face just trying to make ends meet outside of work. You have these very stressed, baseline traumatized nurses that are coming into work and not wondering if they're going to be able to make ends meet that month. It's really very not okay. It's not equitable. It's not fair. And so then you come in, you're short-staffed, you're running your ass off. You've got patients that are on the light that want you to be there at the drop of a hat. And if you are a healthcare consumer and you go into the hospital or you're in a healthcare facility and you're pissed off that your nurse hasn't answered your call light, especially at shift change, consider, or even a CNA, consider that they may be short-staffed and they're doing the best that they possibly can, and it doesn't always mean that you're being neglected. Let's also talk about PICU. So because I'm an LVN, I have not worked in pediatric ICU, which is what PICU is. But I have worked with peds, over the years, a long time. I did trach vent nursing for medically fragile children and infants and young adults for a while, and I enjoyed my work immensely, but it is not for the faint of heart. And so I also, had a medically fragile nephew that is no longer with us. And that is an especially difficult task, to usher a child through a really complex situation, the family through a very complex situation, and sometimes end of life. And you just don't, people talk about how it's unnatural, for parents to bury their children, and it is. So I can only imagine the stress that she must have felt, especially when she's talking about feeling hesitant to jump into codes. Yeah, we look at Redonda Vought and how there was a medical error made that was honestly signed off on by the higher ups, the C-suite executives or whatever. I don't even remember the nitty-gritty details of that. But suffice to say, she went to court and she was found liable, and nurses can go to jail for medical errors, or their licenses can be sanctioned for errors. And it's a very scary world out there, because your facilities, like Redonda Vought's facility, can throw you under the bus. And this is one of the reasons why I advocate for every single nurse to carry their own liability malpractice insurance. Your facility is not going to go to bat for you, but if you have a good liability insurance company backing you, they will send somebody to court to fight on your behalf. As long as it's not gross negligence, a very egregious error, you need somebody in your corner. And a lot of times, and as I've discussed, we don't have the general public backing us. We have a lot of people, who judge us for situations that they could not imagine being in either. And a lot of times we get a lot of hate from the nursing community, and that's what Anna's facing. And girl, I'm sorry, that you're facing all of this. I am so happy for you. Good luck to you on your future endeavors. If you're still here, please consider taking a look at my page, because I am starting to get into nurse advocacy, because we do need more people fighting for us. And thank you all for the work that you do. And thank you for listening to me rant for a little bit. Thank you, bye. Okay, no, I lied. One last thing. This video didn't even touch on how we are routinely assaulted at work, and very few people have our backs, and very few patients are prosecuted. It's a thing. Okay, I love you. Thank you. Bye.